Good morning, everyone. Today, this is the continuation of the previous lecture, like the bone tumors part two. And the bottom line, which we are going to cover in this lecture, is that we are going to talk about the malignant tumors. And other than malignant tumors, I will talk a little about secondary bone tumors, or what you can say metastatic bone tumors. As I told you in the previous lecture, primary bone tumors are more common in children, whereas secondary bone tumors or metastatic bone tumors are more common in adults. So, to continue, um, like of course you have, if you have seen uh, the part one of this lecture, then you must know that we had already covered a lot of tumors, like you can say. um the benign tumors like osteoma, osteoid, osteoma, osteoblastoma, endochondroma, and then we talk about intermediate bone tumors, and um, today we are going to talk about the malignant tumors. So, talking about the malignant tumors, by the way, or malignant primary bone tumors, of course, like they are many. uh, but like of course your surgical books doesn't cover all of them, um, but what they cover is the important one. So two of the very important malignant tumors, one is called as osteosarcoma and the other one is Ewing's sarcoma. There is one more very important topic that is called as multiple myeloma. But remember that multiple myeloma is a hematological cancer, or it's a hematological malignancy. It's not a bone tumor. So that's why, though I will talk a little about multiple myeloma in this lecture, but the important point to mention over here is that multiple myeloma is basically a hematological tumor or hematological malignancy rather than bone malignancy, right? So keep this thing in mind. Okay, so to start with, osteosarcoma, if you can see over here, there are a few of the points which are written over here, like the highest incidence of malignant primary bone tumor occur in children and adolescents, and rapid growth, early stage lung metastasis. And lung metastasis means that the patient will die soon, and with new treatments, you can say, like chemotherapy. uh, but like nowadays, of course, we have some treatments which were not available before, and of course, like surgeries to remove the tumor, and of course, like in that case, we have to remove the bone. um, we can apply in many of the patients. You can see over here, you can see over here, you can see over here, of course, like this is the clinical features you can see, and this is the imaging which you can see. So osteosarcoma, by the way, osteo, you know what is that, and sarcoma again. I think many of you know what is that. Uh, and many of you who don't know, basically, um, sarcoma, we say to any malignancy that arise from the mesenchymal cells. Okay, so so simply it's osteosarcoma, or that, like that's why it is also called as osteogenic sarcoma. So uh, because it arises from the mesenchymal cells, right? So of course, like mesenchymal cells, or you can say connective tissues. Now the thing to understand is here is, like, of course, there is, like, when we say connective tissue, it means like we refer to anything, like it could be uh, vessels, it could be bone, it could be anything, right? So that's why collectively they call it as sarcoma. So that's why it is called as osteogenic. or sarcoma or osteosarcoma, because it arises from the connective tissue. So now, the important thing over here is uh, like this one is like the important topic, you can say, in primary malignant bone tumors, right? So of course, like if you will see over here, of course, like this is the tumor which is very much enlarged, but how the patient present is basically, the patient initially they feel some pain, which is like worse at the night, and what happened like and then of course like it keep on growing. Okay, so you can see over here, for example, okay, of course, like in this one the tumor is growing, but for example, if the tumor is localized in the bone, so what can occur, of course, at that area the bone can be weak, and due to that weakness sometimes the bone can get fractured, and in that case what we call it as pathological fracture. And to many of you who don't know what is pathological fracture, basically, of course, like we have strong bones like the normal people, and it requires what you can say some force to break the bone. But in some of the people who have some bone disease or malignancies, the bones can break basically by applying or by the forces which are too little in a sense to break a bone. But when their bone is broken, for example, we go to shopping, we grab a packet of 5 kilograms and we can carry it back home. But for example, someone who is picking a 5 kilogram packet, and in response to that, if there is a vertebral fracture, so of course, like there could be some reason, or there could be some pathology, like the bone is too much weak, or like in females after menopause, that they have less bones density, so we call it as osteoporosis, so they can also have that kind of fracture. So simply what I mean to say here is like osteosarcoma can occur in like can present with pain, can present as a localized swelling or localized mass or localized tumor, whatever you want to say, or it can present as a pathological fracture. So this is how the patient present. Now, uh, basically, uh, in like regarding osteosarcoma, um, they did a lot of research and they found that it could be due to uh, chromosomal deletions, like familial cases can be there, like it runs in families, or it could be associated with certain syndromes. Okay, um, Lee from any syndrome is one of them, but like it's like so. It's such a question. Very rarely, somebody so like you are going to find this question anywhere on any exam. Of course, I haven't seen any, like this question. So now this thing uh, can be there. Uh, Now, one of the things to remember about osteosarcoma is that they grow at the site where the bone is growing, and that's why they are very common, or they occur more in children rather than adults, right? So, uh, like if you know that what are the sites of bone growth, uh, the osteoblastic cells are the one which make the bone. So uh, what happens, like these osteoblast cells, they uh, like when they are you can say multiplying or proliferating, it can develop into osteosarcoma. So uh, so what you will found, like you will found this tumor at the end of the long bones in the metaphysis, and so that's the reason, like it affects the what you can say the distal end of the femur or the proximal end of the tibia, or the proximal end of what you can say humerus. Okay, so most commonly it happens in proximal end of uh, tibia, okay, or humerus or distal end of femur. These are the common sites, but you can say more than 50% of the tumors you will find around the knee, and the rest of the 50% of the tumors you can find elsewhere in the body. So the the region around the knee is the most common site for this tumor. Uh, Other few points. Okay, so simply, of course, like this is the clinical presentation. This is how the tumor present, and later on, of course, we can do imaging. We can do X-ray. You can see X-ray, CT scan, MRIs, or bone scanning, or we can do a biopsy. So one of the thing, okay, which one very important point to remember about this tumor is that what we see on an X-ray is a Codman triangle. Codman triangle. So now, what is Codman triangle? Is basically when the tumor it reaches the periosteum, and you can see the periosteum is raised. So this triangle is called as a Codman triangle. So of course, like whenever we do X-ray, whenever we do CT scan, whenever we do MRI, whatever, like whenever we see Codman triangle, this is like something which raise suspicions, and we must go for bone biopsy. And of course, like the definitive diagnosis will be done on bone biopsy, and like of course, like based on that, then we go for the staging and so on and so forth. So like of course in the previous lecture I already told you that how we uh, approach the cancers, or how we treat, or how we diagnose, and what are the investigations we must do. Okay, so guys, like the treatment is so like simple to understand. What we have to do, we have to remove the tumor, okay, and surgery is uh, the best treatment, or you can say the treatment of choice for osteosarcoma. So of course, like this is which means like we have to amputate that area, followed by prosthesis, of course, to rebuild, or like to give maximum mobility or rehabilitate the patient. Nowadays, there are new drugs which are available, which like or chemotherapeutic drugs which are available, um, which can be given to these patients. Uh, and there are many like newer and newer drugs which are coming. So chemotherapy can be given, right? And chemotherapy, there are different drugs, like in most of the cancers, the drugs names are almost same, and the same drugs are used. You can say cyclophosphamide, and cisplatin, and adriamycin, and all these drugs. Of course, they are chemotherapeutic drugs. Okay, the bad thing, this cancer have a very bad prognosis. Okay, so this is very important to remember. Okay, that this cancer have a high mortality rate. So of course, like in staging, of course, like how you will tell the prognosis, that either it's at stage one, two, three, whatever, right? The stage it is. So of course, stage one means like what you can say, um, localized tumor, and stage three is when there is metastasis. And remember, if you can see over here, a lung metastasis is the most common place which can it can occur. Other than that, remember, they are more common in children. All the primary tumors are more common in children. So after that, osteosarcoma, we will go for Ewing's sarcoma. Now, again, like what is sarcoma? Okay, so okay, you can see basically there is small round cell tumor originated in the intramedullary rapid growth, early stage lung metastasis, mainly in young people, radiotherapy before surgery, and it also have a bad prognosis. Now, if you will see over imaging over here and over here, you are going to find a Codman triangle over here. But if you will see these images, what you're finding, you found a onion type of structure. Okay, basically, why I'm saying onion type of structure, just to make you remember that, uh, like they have onion skinning layout. Okay, again, same things, no difference. The patient present with again pain, swelling, okay, these kind of things, okay. But the differences between osteosarcoma and Ewing sarcomas, I'm going to talk about that. Okay, Ewing sarcoma occur more commonly in males. Okay, especially like simply boys, childhood males. Okay, okay. One more thing. Uh, the most common place is basically it can occur in the pelvis or again or in the long bones, especially around the growth plates. Okay, and the most common site is basically femur. Okay, the most common site is femur, and then comes the tibia, and then comes the humerus. Now the patients, they present with swelling, like the same story of osteosarcoma. You can apply over here as well. Okay, now um, again, how we diagnose them, we go for again X-ray, CT scan, MRI, and for sure, like to make the confirmatory diagnosis, you have to go for a bone biopsy, right? So basically, if you can see over here, this photograph, this histological picture, there is a small um, blue round cells, okay, and they have a clear cytoplasm. So this is how they identify these kind of cells, okay. And now, as I told you, uh, the important thing is onion skin, okay. Okay, so basically the periosteal reaction, which produces Codman triangle in osteosarcoma, it produces onion skinning in the case of Ewing sarcoma. So you can see, like, even on the X-ray, you can catch what kind of tumor it is, right? And of course, like based on this thing, you can differentiate either it's Ewing's or either it's osteosarcoma, right? Now, the important thing to talk about this tumor is, you can see over here radiotherapy before surgery. So basically, what they give, they give the patient again chemotherapeutic drugs like cyclophosphamide, again adriamycin, and all these drugs. Also, they do radiotherapy, and what you can say, later on, they can do surgery. Okay, but like it can be like, you can say the results are good, chemotherapeutic and radiotherapeutic results are good, but of course, like if it cannot be, like if the drugs are not acting or chemotherapy is not helping, of course they go for the surgery. So in surgery, of course, they are going to remove that thing. Nowadays, by the way, there are very expensive drugs are also available, which are monoclonal drugs and things like this. Of course, like they can help. Okay. Um, Now the important thing, of course, in this one also, you are going to go for a metastatic workup, okay, and you will see like either there is any metastasis in the lungs or in any other area of the body, and of course, like based on that, you will decide either to give chemotherapy therapy or radiotherapy or whatever XYZ treatment. in these patients or not. So that is about Ewing sarcoma. After that, as I told you, multiple myeloma see originate in the bone marrow. So remember that um, multiple myeloma is basically a hematological cancer. So you can say malignant plasma cell tumor can be single or multiple, occurs in adults, spine or other bones, and there is osteolytic lesions. Okay, and the blood and urine shows Benz-Jones proteins. Okay, uh, guys, maybe you won't understand this thing over here, but um, I think like in internal medicine, you have done multiple myeloma. So anyone who remember that topic, I think they will understand it completely. I can tell you a few points which can help you in many MCQs, not surgery, um, but in many other subjects, because there are many typical pet questions which come from this one, and uh, like you can answer them easily. Uh, so you can say, like you can see multiple myeloma, like what happens, it does not affect the bones, rather it affect all the body. It affect the kidneys, it affect the blood. It affect like multiple, you can say all the body, it affect, right? So one of the thing um, which occur in multiple myeloma is basically osteolytic lesions, right? And the patient present in the same way, like bone pain and all this stuff, but of course, like these proteins, like there is hyperproliferation of plasma cells, so they are circulating in the blood. They can cause many things, like they can damage the kidneys, they can even cause stroke or blindness, anything, because the blood, in very simple words, you can say the blood become thick. Okay, things like this. So if you will talk about what you can say, uh, the pet questions which come from this one is basically what happens, like one of the thing is Benzone's proteins. Whenever you'll find this question, of course, like the question is about multiple myeloma. And the other thing which is very important is like when they go for the X-ray, they found lytic lesions. Now, what is lytic lesions? Is basically, you can see over here, uh, there is no bone mass over here. There's no bone mass over here. There is no bone mass over here. Okay, so you can see like there is loss of bones, in different areas. So it means um like there is lytic lesions, like it's eaten up, you can say. And when we take the X-ray of the skull, especially, these lesions, they give a look of, you can say, the pepper pot, like, so that's why it is called as pepper pot skull. Okay, like multiple black, what you can say, holes in the skull. So we call it as um, pepper pot skull. Or punched out lesions are there. Multiple punched out lesions are there. So this is one of the important questions, like they love to ask in different MCQs exams, and either like they give you the benzoate proteins, or either they give you the um, pepper pot skull. Okay, just to, and whenever like these, you can say, keywords are coming in any of the question, of course, like they are pointing towards multiple myeloma. Okay. So regarding, of course, like the details of this one, of course, like you guys have done this thing in medicine. So of course, like I think you already know much of the details about this cancer or about this malignancy. Okay, so after that, uh, you can see. Okay, talking about the metastatic or the secondary bone tumors, guys. You can see over here, top three cancer prone to bone metastasis are breast cancer, prostate cancer, lung cancer, and after that, kidney cancer or bladder cancer. And bone metastasis is most common in the spine, followed by the long bones, and there are osteolytic lesions. Not always, but okay, most of the time there is intense pain. And when we do the bloods, what we found is like the calcium is high and the alkaline phosphatase is high as well. Like remember, whenever there is something going on in the bone, uh, alkaline phosphatase become high. And of course, we go for PET scanning. Okay, in these patients, you can see over here. This is like the imaging of the PET scanning. Talking about the metastatic bone tumor, especially, uh, of course, like they occur in the adults because breast cancer, prostate cancer, lung cancer, they are more common in adults. So, what happens is that uh, one of the things which I was telling you that there could be uh, compression fractures of the vertebra due to metastasis in this region. So, like what they do is like sometimes they fix the spine, especially, or sometimes they have to do like decompression surgeries to save the spinal cord. Of course, like that is the most important thing. Okay, one of the thing to remember, or some of the points to remember about this one. Um, any patient who have cancer, any cancer, by the way, of the body, uh, when we do staging, of course, we go for the PET scanning. And what is the reason of doing PET scanning is simply uh, to check like either the tumor uh, is affecting any bone or there is any metastasis to any part of the any bone, right? So that's why PET scanning is a very, very, very important investigation to stage the tumors or to stage the cancers. And of course, like when they found anything, they can go on further examination, like for example, biopsy. Now, uh, the important thing is whenever there is secondary bone tumors, of course, one of the thing is that you are going to treat the cancer. For example, in female, maybe it's if it's because of breast cancer, you are going to treat that breast cancer. If it's due to prostate cancer, so of course you will treat that. But the problems which are arising as a result of metastasis, um, you are going to deal with that as well. For example, one of the thing I told you is spine fixation, right? Of course, there are many other treatments uh, like um, so certain drugs can be given, by the way. Okay, uh, like pamidronate can be given. Okay, and like so whatever like is done, of course, uh, that is decided according to the condition of the patient. For example, a patient who have malignancy and he have many other comorbidities, he is old, he have diabetes, he have um, like some heart condition, renal failure. Of course, like every patient have different uh, picture, right? So I cannot say, or no one can say that this kind of treatment will be given to every patient. Of course, like there is panel of doctor who decide what is best in that particular case. Either uh, surgery is needed, either fixation is needed, either they can do what we say as radiotherapy can be given, right? So these things. Uh, so simply, um, uh, that's the important thing to understand. But sometimes, when the cancer cannot be treated anymore, so radiotherapy can be given just for as a palliative therapy, like simply to relieve the pain, right? Or I talk about the uh, vertebral fixation, for example. Why that thing is important? That of course, in that case, we have to save the spinal cord because if the spinal cord is compressed, of course there will be pain, but there could be uh, compression of the nerves, and the person maybe cannot walk or any other XYZ type of thing can like the patient may have. So in some very simple words, I'm telling you, like it depends on the status of the patient. Either they should undergo, like what they should undergo, right? Of course, like the surgeon, the oncologist, and you can say a multidisciplinary team decide what is best in that particular case. So again, chemotherapy and radiotherapy are often used, sometimes surgery, uh, and for advanced cancer cases, surgery is often used for biopsy. So this is like about all the tumors which we have to cover. Uh, some of the things which are, again, some few things which are extra in this lecture, you can find over here, that these are tumor-like lesions. Of course, they are not tumors. So one of the things is bone cyst. So bone cyst, you can see over here. Of course, like there is nothing there. If you know the definition of cyst, you would understand. A cyst is like collection of anything or fluid, especially lined by the endothelial lining. So now, bone cyst, as you can see over here, occurs in children and adolescents, and they are self-limiting, they are painless, they are slow growing, and small lesions, of course, they don't need any treatment. But of course, like for example, in this one, see if the cyst is too much big, which means the bone is too much weak, right? So when the cyst is too much big and the bone is too much weak, of course, like there is risk of pathological fracture. So in that case, what they do is like the bone graft. Of course, like they fill this area with some cement, or bone grafting means like they can take the part of the bone from, most commonly, iliac crust is taken. That is, you can say, extra bone which is available in the body, and can be implanted at other place. Nowadays, of course, a lot of other processes are also available, like you can say synthetic materials are also available, but of course, like beyond our discussion or beyond our scope, right? Then there is tumor-like lesion, which is eosinophilic granuloma, and this is basically a kind of histiocytosis, and it occurs in children and young adults. And you can see over here, um, if you can see over here, that there will be osteolytic lesions with histiocytes and eosinophils accumulated. And you can see over here that it's written that the single lesion have good prognosis, whereas multiple lesions have bad prognosis, right? So you can see over here lytic lesions, right? I think, like, until now you understand what are lytic lesions, like very easy to understand. So histocytosis. Well, like, what is histocytosis? Histocytosis, simply, it is what you can say. Uh, Histocytes are tissue macrophages, so they are like the collection of too much histocytes or tissue macrophages, whatever you can say. So this is also a tumor-like lesion, but not a tumor. But then you can see over here fibrous dysplasia of the bone. So this one occurs in young and middle-aged adults, and single and multiple. It can be single, it can be multiple, and there is fibrous bone in the bone marrow cavity, right? And slow progress lesion, expensive, can lead to skeletal deformity. And simply, what is the treatment is curettage and bone grafting. Very easy to remember. And the name shows, fibrous dysplasia. So, what is dysplasia in pathology. All these terms are very well explained. And what is fiber or fibrous lesion. Uh, so simply, these are the fibrous lesions which occur in the bone marrow cavity. Um, so what you can say, okay, there's a case discussion over here. Male, 28 years old, right ankle pain for 6 months, and X-ray shows cystic changes in the right talus bone. Okay, and CT showed bone destruction in talus, but the talus overall morphology is intact. No soft tissue involvement is there, and you can see over here. Okay, so what can be considered? Of course, you can say uh, we go like in this way that first of all, X-ray showing cystic changes, right? So of course, like if it's a cancer, for example, so either you will found uh, Codman triangle, either you are going to find some soft tissue involvement, okay, or either you will found swelling, simply things like this, right? But of course, like we cannot find anything like over here, okay. So you can see over here that what is our differential diagnosis? Of course, either it could be a bone cyst or any other benign lesion, right? Not a malignancy. So of course, like this thing, and of course it's a primary problem. Like of course it's not a metastasis, it's not a tumor simply. So there is curettage is done and calcium sulfate implantation was performed. So you can see over here after that, everything is fine. Like they fill that cavity. So when they fill that cavity, of course, that cyst is filled now, and the stress is reduced on that bone, and of course the patient feel fine later on. So this is how the treatment is done. And the post-operative treatment, maintain plaster immobilization for 6 weeks, prohibited weight loading for 3 months, um, and X-ray every 3 months. Like this is the follow-up. Of course, whenever we perform any surgery, we go for follow-up to determine the functional exercise progress, right? And the talar lesion curettage area completely generated by new bone healing and without recurrence in continuous 2 years, it is considered like eradicated or cured. So see, if you will go in a logical way, of course, like if a patient will come and you found, for example, a periosteal reaction over here, or you can say the onion scanning, then of course you will not proceed in this way. Rather, you are going to do all the bloods, you are going to take a bone biopsy, you are going to perform a CT, you are going to perform a PET scanning, you are going to perform a chest X-ray or chest CT scan, of course, to look for the secondaries. And then based on that, of course, you will decide like based on those results, when that thing will come, uh, we can further move on, like we can do staging. uh, of course the patient will be presenting some constitutional symptoms like weight loss, fever, anorexia, anything, any of these can present. So of course, like in that case, then we will decide either surgery should be done based on the histological findings and all those things. Either surgery should be done or what thing should be done. So that will be done completely um, on the results of that. So that's all about the bone tumors. Okay, there were like 4 lectures, 4 hours of lectures, like 4 classes, by the way, which is basically uh, like when we study in the classroom. Of course, a lot of time is like wasted, in break time and in questioning. So this is all the discussion about the bone tumors. I hope you understand. Easy to remember, easy to understand. Whenever we found anything like a name of the tumor, think about, like, the names have the clues, like osteosarcoma, or and some of the tumors, of course, like they are named on the name of the person who discovered them, then of course like it's hard to uh, like sort out, what kind of tumor is that. So anyhow, thank you guys. I hope you understand, and I will see you in the next lecture.